Our last person is in.
Whenever you're ready. You can either tell them that we're waiting on the people or we'll get started.
All right. Welcome, everybody, to the September 3rd, 2020 meeting of the CARES Stimulus Review Team. We have, it looks like, all of our voting members present. So, Brent, I'm going to toss the meeting over to you.
Thank you, Aaron. Good morning, everyone. I'll now officially call to order this meeting of the Financial Stimulus Review Team appointed by the Sedgwick County Commission. And Aaron, if we could do an official roll call at this time, I think that would be in order.
Absolutely. Dr. Walker?
My screen indicates that she's still connecting to audio.
Yes, I'm seeing that as well. So we'll come back to her. Melody?
Here.
Jane?
Here.
Kyle?
Here.
Mark? It looks like Mark dropped out. So Mark is not with us currently. Hopefully he'll get back in. But we do have a, Brent?
Here.
And Hope.
Here.
Thank you very much. Now we have a quorum, so we can begin. Brent, do you want to take us into the discussion over last week's meeting with the Board of County Commissioners?
Sure. Thank you. Before we get into that, I just want to, we received the minutes from the meetings of August 20th and August 27th, 2020. I would entertain a motion to approve unless there are additions or alterations to those minutes.
Move
Make
to
a motion
approve.
to approve.
Second.
It's been moved and seconded to approve the minutes from the August 20th and August 27th meeting. All members in favor, please indicate by saying aye.
Aye. Aye.
Aye.
Any opposition, same sign. Hearing none, it sounds like the minutes have been approved unanimously. Moving into new business this morning, we had I think a pretty significant meeting last week, the joint meeting with the County Commission, and I think we got a lot of clarity on moving forward in terms of priorities and so forth. So I wanted to give the committee an update on what we've been doing internally at the county to prepare to move forward with that new information. What we have developed is a scoring sheet or a scoring card based on one of the comments we received from one of the commissioners that would help us determine which of the applications are most directly in line with the priorities that we heard. So it's a pretty simple process. It's a 5-point scale. Points are given to the applications based on their alignment with, we heard that PPE and cleaning equipment, cleaning supplies was a high priority. So that would give them a point. If they're serving those historically disadvantaged or at-risk populations, those populations that are in line with the Sedgwick County strategic plan. If the program is sustainable, county-specific, meeting current needs, we're looking at those types of things. And then internally providing them a score from 1 to 5. So the ones with 5 points will be those that are higher priority when we get to the point where the committee is actually reviewing the applications and beginning to make those award recommendations. Because remember that as we move forward in the process, since we're conducting open meetings, we want to stay as transparent as possible, keep the playing field level. So we won't discuss those individual applications until that portal has closed on August 20th, and we convene after that point. So the other thing that's happening is that the communications department at the county has been developing some marketing materials that were shown to the county commission yesterday. That information is going out in the social media. There are also going to be some mailings directly trying to do the outreach to those organizations that are reaching those historically disadvantaged and at-risk populations, making sure that that the word is out so that we have a broad representation of our public health and social service agencies across the county. So there's a push to do that. It's also going on with our other grant program for small businesses, but as it pertains to public health and social services, we are reaching out to them. The other thing in terms of a process going forward is that as we receive applications, internally we will review them. We will do the scoring based on priority. We'll do the risk assessments like we've been doing all along. And then as we're also doing the summaries that Hope has been doing about the asks, then all that information will come to the committee members as we're going through the process. And then you'll have that information to review. And then once the portal closes on the 20th, and the committee convenes then to take a look at applications, you've gotten that information as we've gone along, and we can have email if there's additional information that we need to get from an applicant to make sure that their application is complete. Along those lines, all of the current applicants were sent an email after the joint meeting giving them the information that the portal will close on the 20th, that if they wish to, in light of the new information and new priorities, provide us with additional information to amend that, they can do so. But we're just trying to make sure that everybody knows all the new information, that the priorities that were provided by the BOCC, and make sure everybody's on a level playing field. So those are all the things that have been going on since the last meeting. And I guess I'll now open it up to the committee for any questions. Jane?
So are we going to get these apps? I mean, I don't want to get 40 at once if possible.
We'll be getting them as we complete the scoring and the risk assessment, you'll get it. So the idea is that when we do begin to discuss them specifically and make the award recommendations, those that we agree have a score of 5, those would be the highest priority applications that we would look at first.
And how are you looking at sustainability? Is it of the organization or is it of the program? I think both. The biggest priority that I think we heard was that there would be, if we fund something, that they can sustain it going forward. So if the risk assessment might indicate there's a question about sustainability, that can be taken into consideration. If there's not a funding source after the 1st of January, then it's not a sustainable program. And so we may have a strong organization that's promoting a not sustainable program, and we may fund part of their application, maybe the PPE or the cleaning, but not that program because it's not sustainable. So both are being taken into account. Okay.
Morning, Brent. It's Melissa.
Good morning.
Couple of suggestions. The risk assessment is difficult to navigate partly because I think the total number of points is 72. So It'd be easier if it was on a scale of 100, and I would say the same thing about your 0 to 5 ranking of the proposals. Can we put that on a scale of 0 to 10?
Sure.
Agency applicant would get a 0 if they're not serving older adults, people who are homeless, people who experience severe mental illness, individuals who experience IDD. Who am I missing? Those are the priorities that were discussed, right? Those are the target groups that we're looking at. And if somebody got a 0 on that first measure, which should be most heavily weighted, then we would set that application aside. Correct?
Right.
Okay.
Right.
All right. I want to echo what Jane said, which is we would like to see the applications as they are received, so that it takes a while to go through these applications and to think about them relative to one another, what's there, what's missing, what additional information we might need. It'd be good if the county staff could collect that information now in advance of the 20th, when there's going to be this big rush of applications, or I'm assuming there will be a rush of applications.
Yeah, absolutely. Would you prefer us to do the scoring and the risk assessment and then send you that information with the application? Or would you prefer just to get the applications knowing that we're going through that process prior to the 20th? And I'll leave that up to them.
You and your team have wanted to wait on sharing applications until you've done the scoring. And my preference would be to look through the applications as soon as you receive them, so that we have plenty of time to carefully review the applications. Also, we're probably going to have questions about your evaluation of each applicant. And if there are things that we notice that are missing from the application, we can share that information with you right away, so that you're not waiting until the 20th to go back to the applicant and ask for additional information.
Exactly. Okay.
Last thought is communications is still not doing what needs to happen. There are about 20 agencies that we expect to see applications from, 20 to 30 agencies that aren't in the applicant pool. All they need to do is to reach out to the CEO or the executive director of those organizations, make them aware of the opportunity, and then they're done. They can do that via email and then with a follow-up phone call. It'd probably be good if the committee saw the list of organizations that are being contacted to try and encourage applications.
And can I jump in on that, Brent?
Sure.
Okay, so this is Lindy, and I want to be cognizant. We've talked about that conflict of interest provision, and the fact that we need to have somewhat of a level playing field. And so we've actually talked with the auditor who we're using to consult with in our eligibility, Witt O'Brien's, who's our eligibility folks. We can certainly target and get word out, but what we can't do is reach out to specific agencies, because then it looks like we're trying to pick the people that we give money to, as opposed to opening up a grant application process. And so I am certainly cognizant of your concerns, and I know that they have a strategy to try and reach out in a blanket way to those folks, but we need to be careful about doing that direct communication with specific agencies, because that can get us in some trouble when they come in and audit us on the uniform guidance provisions.
Okay, then reach out to the 100 agencies that serve people who are homeless, that deliver healthcare services, that provide mental health services, all 60 of the providers who are part of the Sedgwick County Community Developmental Disability Organization, but email the CEOs, the executive directors, the top people in those organizations. It doesn't feel like that's happening because of the way you talk about it and the way communications has been talking about it so far. I understand the potential conflict of interest, but we're not doing this effectively.
We have a meeting with them right after this one, so I'll pass those concerns along.
I'm a little concerned about the time frame. I really would like to get this money flowing, and I just, at the rate we're going, every application we have to go back, it seems like, to the applicant with questions. So we're looking at the money not flowing until at least November, it looks to me like. Unless maybe we should schedule like a half-day meeting after, so that we can make more progress and actually get some funding to groups. A lot of these groups are wanting to deal with kids who are now, in their facilities going to school. Well, they need that money now to hire staff, if we're going to approve them, that is. But I'm worried about the timing.
Okay, I think our goal is to, once the portal has closed, we're certainly open to a longer meeting if it's a half day, full day, whatever it needs to be. And that's one of the reasons we want to get the applications to you early, get the scoring to you early. So I think with the scoring, we then would prioritize those that have the highest scores that meet the needs as we go through them. And once we make those award recommendations, the next county commission meeting after the portal closes and we'll be meeting would be on October 7th. So one of the commitments that I made was that we could forward suggestions for funding to the commission on the 7th of October. If they approve it, then the process gets a lot faster. So I share your concerns. I feel like this year moved very slowly in March and April, and all of a sudden it's making up for lost time.
My questions are going to center around some of the questions that were asked actually to the Board of County Commissioners. And there was and you've mentioned them in terms of what I would call capturing the strong points of what was raised during the joint meeting. And so when describing the historically disadvantaged vulnerable populations, as it's posed in the Sedgwick County Strategic Plan, that's not what I heard last week. So I'm glad to know that it is actually defined in the strategic plan. And so I would like to either be pointed to that document so that I can read how those, the actual description for those populations, or if you have them to share them now, I would appreciate that, because I just want to be clear on who we're talking about.
Well, in the county strategic plan, and in some of us, we talk about the importance of mental health, aging. And I'm doing this from memory right now. Developmentally disabled. We're certainly wanting to make sure that we have reached out to racial minorities. So any group that's been designated as historically disadvantaged is one, as well as in those ones that specifically list where we do provide specific funding. So those would be the ones that I mentioned.
So is there, I have a good feeling for who those organizations or who those groups are. I just wanted to make sure that we're all on the same page when we make that statement, because now that is one of the criteria, in order for organizations to be funded, which I'm sure it always has been, but it was not necessarily stated and then confirmed. And I'm seeing exactly from someone, it's gone off of the screen, but I'll go back. I'll go back and capture it and read it. Okay, thank you for that. That's helpful. I echo once again Jan's concerns, and you've confirmed it too, is the time schedule that we're on. It's it's such a short window for these organizations to access this funding, to actually appropriately utilize these fundings now. If we meet, I know we have a meeting scheduled on the 24th. I believe it's the 24th of September. I'm going to be traveling on that day. I really want to be a part of that discussion. So I just wanted to share that early so that everyone will know. I should be able to Zoom in if that's an option. If we choose to extend the day, which I think is a great option too, I think that will give us more dedicated time to really focus in on who we have and the questions that we have in front of us to consider, and any questions that we might have. So I would support extending the day if it's that day, and if we could actually meet the day before that, it would be even easier for me to physically be there if that's what's chosen to do. So I wanted to put that out there. Now, lastly, I think what I heard from the commissioners also is there's quite a bit of autonomy that the commission has given to this committee, to this board, to make some decisions. And is in terms of prioritization, if indeed it falls within the guides of what is important to Sedgwick County and where we know the needs are, is there, when we were talking before, we were looking at the amount of money that we have to grant, and then the number of organizations that are requesting and the overwhelming amount of funds that is being requested. We're thinking, I guess and I'm just walking my way through it. So I guess our thinking is that now this ranking system that we have will help us to put those organizations at the front of the list, and gives them a priority in terms of consideration of funding. Is that what this ranking system is intended to do?
Exactly.
This can go to the board. This can go to the committee, the committee members.
Right.
I love.
Yeah, is exactly what it's intended to do, is prioritize them based on the scoring, and the scoring's based on the priorities that the commission's established. And then it'll also help us be a little more, I think, more efficient going through them as we're looking at these.
The big elephant on the table is the hospitals. And if you take the hospitals out, we've got money. So I heard the commission say that was not a priority. Now, whether that's the correct action, I haven't decided what I think about that, but we've got to get some answer if they're getting money from the state, or are we going to leave the hospitals high and dry and fund these other organizations? I don't know the answer to that, but I think that's a big question.
And Brent, have we shared the provider relief funding that the hospitals received with this group?
No.
No,
Okay.
we haven't.
So they've received significant funding through another section of CARES funding, both Ascension and Wesley. And so the commission, at least in discussions, because this is not the first time they've heard this ask, there was actually a separate ask that they made directly to the commission. There was a special meeting set up, at least by Ascension, and it did not gain traction at that time, because there were other opportunities for that funding to come in. And what we're hearing is, in this next round of funding that supposedly is coming from the federal government, there will be additional support for those health measures. And so I think maybe that was what this team was getting at when they spoke with the commission about maybe trying to prioritize those who hadn't had funding, other funding opportunities like those folks have, I think you'll see that many of the groups that applied, especially the not-for-profits, haven't necessarily fit the bill for the Paycheck Protection Program or some of those other things. So they may not have had opportunities for relief. And so that may be a consideration for prioritizing them as well, is if they have not had opportunities for that additional funding. Thank you for letting me jump in.
Yeah.
Lindsay, this is Melissa. It would be helpful if the committee had information from each applicant about what funding they've applied for. So the Provider Relief Act, CARES funding for agencies that receive Medicare, Medicaid, and CHIP reimbursement. Some agencies, some applicants have indicated that they have applied for that. We'd like to know which agencies have applied and for how much. My guess is most of them haven't heard. We spoke about Spark at the BOCC meeting last week, which organizations have applied for that funding. Round one of that funding may already have been let out, I don't know, but round one is us, health. So funding for testing, tracing, PPE. So who's applied for that among our applicant pool? Have they heard? How much is the request? Those are the two big pots of money that I'm aware of. The HHS Provider Relief Fund and the Spark Fund, the money that came to the state and the round one piece of that, that's specifically for health and human services. That would be really useful information to have. I would also echo the comments of my colleagues who are concerned about timing. So far, of the applications that I've had an opportunity to review, which is most of the ones that we have, I think I'm about 80% through them, nobody's heard anything or gotten anything yet, which means for some agencies, people who are homeless who are now housed or receiving services may be on the edge of being on the street again or evicted from stable housing. People who experience severe mental illness, who need medication and are getting it through comp care and other agencies and are stable right now. For those of us who don't experience these things, it's hard to be stable. So imagine if you experienced homelessness or addiction or severe mental illness. Those individuals are on the edge of instability and homelessness, which is going to put a burden on public safety and all the providers, many of whom are not as fully engaged in service delivery as they normally are. I can recall one applicant saying only about half of their population who they normally serve is currently being served, which means their target audience, half of them aren't even getting support services, which means for some populations, people with IDD, for example, they're going backwards, they're losing skills. So it's really important to move forward on these applications as quickly as we can. And I would like this committee to have input into the scoring system that you're using to prioritize the applications. I thought the county manager clearly said that the committee has his trust, and it seemed that the BOCC agreed with that. So I think this would be a good conversation for us to have together this morning. What exactly are the priorities beyond people who are homeless, experience IDD, severe mental illness, older adults, and health? And to echo what Melody said, overlaid on all of that is the disparate effect of COVID-19 on vulnerable populations, specifically communities of color. Mm-hmm. So that needs to be part of the metric too.
No, I appreciate you raising it to a level that engages us as a committee. Because yes, this statement's been made, and there's so much data and research that has been done that shows that is a challenge. And I know that one of the commissioners at the meeting made the statement, if I recall, that it needs to be a broad spread. And I understand that. I truly do. However, there is a benefit in terms of looking at outcomes, effective outcomes. There is a benefit to focusing and targeting these funds for the very populations that most need them, and that will have a rippling effect in terms of positive outcomes for Sedgwick County. So I think the research and data will support that type of focusing, and yeah, I'd love for us as a committee to start to really ferret out what our priorities will be.
Okay. Do you want to tell me how you would like to proceed with that? Do you want, we could build a scoring sheet that gives us 10 points right here. And
Plus.
get consensus on that. And we can use that as we go forward. Like I say, we put together one that's got a 5-point scale, but we can certainly expand it and move forward from there. So if that's the will, we can put that together.
I agree with expanding.
Okay.
So what about the idea of like up to 3 points of the 10 points, or some number of points being whether they're in one of these categories of need, health, aging, so on, and maybe 2 to 3 points, a 2 to 3 point scale, or some number of points associated with the communities of color, vulnerable populations, who the target group is for the organization, so that like 60% of the scale, or some portion of the scale, a large portion of the scale, indicates whether or not they fit into one of the priority areas, and whether or not they're serving vulnerable populations, including communities of color. Just throwing it out there.
Mm-hmm.
Okay.
So is that on a 10-point scale, Melissa? That's on a 10 point. So that's the 6 out of the 10. We'll go to the what's already designated in the strategic plan as priority areas, and 3 points in that area, and then 3 points for disparate, or those that are disproportionately impacted, which are going to be communities of color. Is that what I'm hearing?
Yeah, but I started high because I figured you'd all whittle me down.
Yeah, but I'm just saying, okay, but that's 3 and 3 is what you said. Okay.
So in terms of the targeted population that would align with the county strategic plan, if they meet one of those, they would get all the points. That's what you're saying. If it focuses on aging or developmentally disabled, that then would get the max points, not 1 point for aging, 1 point for.
Well, we could weight it that way. That's a thought. I hadn't thought of that. Interesting idea.
So,
You could get up to 3 points if you serve more than one population, although most agencies specialize, they just do one thing. So, not sure about that, but it's an interesting idea.
mm-hmm. And then if they're serving a community of color, they would get whatever that is for the points there. If it's 2 points, 3 points, that's either they do or they don't kind of question, it sounds to me like.
Yes. So this measure could be, do you serve Black and brown people, basically? That would be, you could get points for that. Another way to think about vulnerable populations is kind of related to the first scale. So we have to think carefully about this, because all of the agencies of the county serve vulnerable populations.
Mm-hmm.
So
So you're,
Most agencies that serve communities of color, some of them serve different communities of color, but most do not. They specialize. Sorry, Melody.
oh, so what I'm thinking along those lines though is that, and I think I stated this last week, was that many of the organizations are going to serve diverse populations. It's just within their pool, and should be. So when specializing or making the specificity of serving communities of color more specific, Black and brown, how does that factor in? Because a nursing home is going to house, I shouldn't say house, is going to service multiple persons from various populations. Likewise, trying to think of who else came before us,
Almost all of them.
Policy, but yeah.
Yeah,
Go ahead.
They all do. So how do you-
this is Kyle. I mean, I struggle, I guess, that when I look at all the ones that, I get what you're saying, Melody, I struggle a little bit with how are you picking out within these organizations that probably serve a lot of those, diverse populations, and almost all of them do. And I don't know how you ferret out a specific greater than the other.
Mm-hmm. Mm-hmm.
I don't either. I think you can do mental health, aging, developmentally disabled. Those are specific organizations, but the racial minorities, I don't know how you do it. I think we should do it, but I'm not sure how to do it.
Yeah, I'm thinking maybe a key word would be prioritization. What populations are you prioritizing in terms of your service? And of course, the service itself has to be COVID related. So, because the fact of the matter is, when looking at the disparities that exist, the overwhelming disparities that exist, they've been in existence. It's not new. So what COVID has done is actually uncovered this longstanding disparities when you look at it across populations and when you look at it within the sector of health. I think what we would be able to do is prioritize and focus within the ranking, the urgency, the seriousness of these populations, of the impact of COVID on these populations, and therefore being able to quantify how we prioritize funding when these populations are being served within this sector of CARES Act funding, if that makes sense.
I'm struggling with how we score it.
I'm too.
And I just don't know how. I mean, if it's, and maybe that gets into, you mentioned the urgency, maybe it gets into the meeting the current needs. So we would prioritize, we might prioritize something that is meeting an immediate need because it's an urgent need, addressing homelessness or whatever, versus standing up a program to take care of an emerging need or something like that.
Or that immediate need would come prior, would have higher standing, higher ranking,
Yeah.
that immediate need would have a higher ranking or higher standing than the consistent and or emerging.
I have a question, kind of what Jane said earlier of, if we get rid of the hospital, we've had 21 million in requests. What does it put us at if we take out the hospital?
Well, then we have plenty of money.
Yeah, we've got enough.
We're like half.
Well, because that was over half of it, and then we're opening up for more applications, obviously. So we might have an issue if we get more applications and go over the dollar amount. But I'm not advocating for. I think we still need to figure out a scoring, some way to rank. But if we open that up, and we have to have a deadline at some point, we get through that, and we're at the amount or under. Well, then is this debate moot because we're going to be able to fund everybody? Or
just to go back on Kyle's, I'm going back to advertising or marketing. I was very disappointed in the headlines in the Eagle. It wasn't that it was wrong, but it was misleading. And if organizations read that, 20 million, they're already got applications way over what's available. I groups thinking, well, then I'm not even going to bother. I don't know if you can get the Eagle to clarify, but if I was an agency and I read that, I wouldn't even bother to put in an app because it looked like all the money was already applied for. It did not break out the hospital request that the county was not prioritizing. So I don't know. I don't know how you do that, but maybe if someone from the Eagles on the call, they could maybe expand on their art. It wasn't that it was wrong. It's just didn't completely clarify where we're at.
I'll bring that up with communications after this call's done, because they're building that marketing plan to go out immediately. Maybe it's a press release to them.
That might work.
Yeah.
I'm sorry. I was a little off topic. I apologize.
Oh, I'm just reading what Dr. Walker Melissa has written, and I definitely support prioritizing PPE, disinfecting first, then support to delivery services remotely. And I know we're all reading this, but I tend to process out loud, so sorry about that. But yeah.
Okay.
So where are we, Brent, in terms of creating this expanded?
Okay. But what we have at this point, before we begin this conversation, I had provided a couple of points for alignment with the strategic plan, whether it served historically disadvantaged or at risk. And then another thing in there had to do with, do the numbers of people that are affected or helped by the funding indicate that it's an effective use of the resources? Because $10,000 for 3 people isn't too effective, but a smaller number that hits a larger population would be a more effective use. Because as you mentioned, it needs to, we heard a comment, Melody, that it needs to be broadly applied, but then we're also trying to target these at-risk groups. That's a tough thing to balance. So that was sort of an attempt maybe to try to do both. Couple of points for PPE, because to a person, I think we heard that should be prioritized. It was immediate need. And then focusing whether the spending was responding to current COVID-19 related needs, that it was, the goods and services would be delivered by the 30th of December,
If it's a new program, can it be fully stood up and operational by the 30th? And then two things that I didn't really assign points to, but they were required. Is it county specific, and is it sustainable beyond 1230 without CARES funds? If it was a program that, if we're giving them funds for PPE,
Right.
yeah, that's sustainable. That doesn't really apply. So I didn't want to assign a point to that if it didn't apply. So those were required. And that's how we got to, or how I got to the 5 points. Now I can expand the alignment with the strategic plan, focus more in on the targeted populations. Maybe a point if the agency focuses on or prioritizes serving Black or brown populations, things things of that nature. So that's just kind of where we were, and we left the risk assessment out of this scoring because that's more for us to know how to monitor the funds. So that's kind of where I was initially. I can certainly expand it, include some of these other comments. I can more heavily weight the alignment with the strategic plan.
I like what you've done so far.
Yeah, except most of the things you just mentioned should get a half a point, not a whole point. So we're only looking at large agencies. I mean, they have to be able to clear a financial bar. So most of them are already serving lots of people. The smaller agencies are unlikely to be in our applicant pool, the final applicant pool. So the criteria that are in the RFP, our assumption is all those criteria are met. And if they're not, it'll show up in the financial scoring, right? So if you want to somehow incorporate the financial score in this score, that's okay, but you only get 1 point for that.
Yeah, I really wasn't trying to incorporate that into, you're talking about the risk assessment.
Yeah, the risk assessment.
It was just kind of informational that would be in one spot, so we would know if it's a high, medium, or a low risk applicant or request.
Yeah. So that's the risk assessment is a separate assessment. Right. It's not, okay, but then we need to understand how these two assessments are going to play together. Is the risk assessment going to have more weight than this tool, this 10-point tool that we're creating now?
I don't think that's my intent, but I think the prioritization, the risk assessment tells us how to monitor. That's the big thing I think that we're going to use it for.
It also tells us if the applicant is qualified in the areas of financial management, which are about 40% of the measures here, grants management, which is the other 40%, and then 20% associated with personnel issues and organizational things. So I feel like some of what you just articulated is already covered by the risk assessment tool. And this tool, the 10-point tool that we're talking about now, should be doing something different. It should be specifying what needs we think are the highest priority. So PPE and disinfecting, if an applicant requests support to deliver services virtually, whatever that looks like, tele-delivery, if you will. If an applicant is requesting support for existing services that need to be delivered in person, or their clients are willing to, and they can figure out a way to deliver in person, and they're asking for support to do that, we should, beyond disinfecting and PPE and so on and so forth, then we should be supporting that. I think those should be priorities and somehow measured in this 0 to 10-point scale. Usually some sounds like that might be coming from my house, but they're not today.
That's so, and it is that comic relief is. I appreciate it.
I need to change my text message thing and turn my phone off.
So, to your point, Melissa, I to an extent agree, but I think some of what I heard Brent stating was different. Was not just a recap of what's already captured in the financial or the risk ranking, and that risk ranking, to me it dovetails directly into the sustainability of an organization also. And if that's important, and it sounds as though, I mean, it is important. So with that being important, I think that the risk assessment takes care of the sustainability. I think the question, it should. So I think what I want to know is, are we about funding programs? This is short-term money. Is this what we want to do, is fund a new program? I'm just throwing that out there.
I think that's a really good question. I don't know about new programs, although I've seen some interesting ideas in the applications we've reviewed so far. But these agencies have lost, in some cases, half of their funding, which means they're not able to deliver services to as many people. We're trying to restore their funding for this calendar year, so that they can, and maybe there'll be more federal funding after the first of the year, who knows. But the effects of COVID on these agencies and their capacity to deliver services has meant that their capacity is greatly diminished. So that means fewer people are being served. Somehow, this scale that we're creating needs to recognize that. They're not building capacity they don't already have. They have the capacity. And so far, it appears most of the agencies are retaining staff. I have no idea how they're doing that. But they have the capacity to deliver services, so we need to support that, right? Is to support delivery of services through remote delivery of services and through whatever they need beyond PPE and disinfecting to deliver services on site. So that they can, physically distance or whatever is needed.
Mm-hmm. Mm-hmm.
I think, Melanie, another way that I have looked at whether it's a new program or funding a program is the new program a new way of delivering the same service that they were doing before? Did they pivot from doing in-person to telework? So I think that's kind of the focus, and is that a sustainable model as they go forward? That's kind of how I've looked at the new programs.
Okay.
So that's the lens I was looking at them through.
I like that lens, and I like the direct service lens. Does it directly affect clients? Does it directly affect program participants? I'm less enthusiastic about requests that are asking to support remote working of administrative staff. I mean, usually the administrative staff is smaller than the program delivery staff. They could potentially be working at work and physically distancing. But if it's associated with delivering services, then I think it should be a priority.
Have we gotten any further with building the ranking?
I'm taking some notes that I think I can incorporate.
maybe we've generated about as many ideas as we can on this topic, and we leave it to you all to flesh it out a little bit more.
Okay.
Should we meet again prior to the already designated 24th?
Yes, that's one of the things that we wanted to talk about is as we move through the process between now and either the close of the applications or that meeting scheduled after that, we could continue to meet on Thursdays. Don't want to meet just to meet, but if we have things that we need to discuss as a group, absolutely. But we're going to continue to send you the applications. I think the next thing that we need to do is send you a scoring sheet so you understand
Yes, please.
how we're getting to a 7 or an 8 or a 3, and everybody's bought into that process. And then and a lot of those kind of things. Kevin, I'm going to defer to you here for a minute. If we're having some email conversations about things like a scoring matrix or something, we're not going to be violating any open meetings statutes by working out those details without having a follow-up, a meeting. Is that correct?
Well, that's a little troubling.
Okay.
We've decided that this is an open meeting process. What we could do is maybe within the staff, try and put together some various ideas in terms of how this might go. And then if we get together for our next meeting, then we can have circulated all that in advance. And then maybe either go ahead and take a vote on it or kind of hash it out. But I think that's how we're going to have to do that.
Okay. Well, thank you. So I think then the call to action for us is going to be to develop the scoring criteria. We'll send that in advance, and then we would vote on and approve that at our next meeting, which we do. We're set up to do one next Thursday morning. An update on different communications activities, things that are going on at that point. And then we're getting closer to that application deadline. And we'll just continue to send applications with the work that we've done on them at that point. Because the worst thing to happen is to wait till the 20th and then have 70 to review and then have to start making award recommendations after that. And we can certainly look to the meeting after the close of the applications. We're early enough that we could change that date if we need to accommodate Melody's schedule.
I'd appreciate that. Understanding everyone would need to agree to that.
And so you would want it prior to the 20, you said the 23rd.
The 23rd would be fine.
Okay.
Brent,
Is there-
sorry.
Oh,
Dr. Walker, go ahead.
yeah.
I was going somewhere different. Is it possible for the staff to also gather from each of the applicants as they come in and the organizations that have already applied, whether they've applied for Provider Relief Act funding or for Spark funding for that round 1 funding?
Good one.
I think we're
also,
capturing some of that, and we can just follow up and see their success in obtaining those funds.
that'd be good. And then any questions that Hope would have or Shannon would have, we're going to have. So or you would have, Brent. So as applications arrive, if there are things that are unclear or incomplete or you don't understand what they're asking for, we're going to have the same questions. So feel free to reach out to the organizations
Right.
and gather that information while we're while we're waiting for the deadline to pass.
I see hope nodding.
Brent, the other question I had is, this committee actually has approved about 240,000 of spending, but that has not gone to the county commission to actually approve. Are you holding that up?
They did approve the first one that we did, and then
Rest.
and so then those other funds, I haven't taken them before the commission because we're going to do the joint meeting. And I think now we're at a point where our guidance is probably not to do that because we're going to reduce the pool of funds left for everybody else.
Okay. The commission also mentioned, should this committee meet with someone from the Sparks Committee? And what's happened with that?
I wanted to hear from everybody if that is something that you want to meet with those local folks. I think the question there is, what are their competing sources of funds? Well, not competing, but additional sources of funds are out there, and maybe get a feeling for where the Sparks Committee may be headed. So we can certainly set that up and invite them to the next meeting if you want us to do that.
Or you, the county staff, can just reach out to them and find out what the status of the round one grants are. And Jane, if you want to meet with them when Brent and company do that, that's fine by me. But I don't want to slow them down trying to juggle all of our schedules.
I agree, but just so we have communication back and forth, what they've approved, or do we notify them of what we've approved, or it'd be nice if we could work together a little bit.
All right.
And Jane, I think I've been calling you Jan today.
Yeah, it's Jane.
I know.
I get called that all the time, so
Sorry.
no problem.
Is there a way, this is Kyle, like, I don't want to lose the big picture of, I still go back to whether we do the hospital or not. I know we don't really have to make that decision at this point in time, but like, I feel like we're getting very bogged down, like when we're reviewing these applications, like obviously if we wait until the 24th, and then we're going to have a bunch to review, like, if we're prioritizing PPE or increased disinfection costs, like when I look at those totals for applications we had as of August 24th, we're like at, I don't know, $1 million, $500,000. I mean, it's way low. So could we pull those out of the apps and like summarize each one, like what their request for PPE was, so we can look at them more cumulatively for like that cost, if that's going to be our priority, or is that jumping ahead too much?
I think we already have a really nice summary in the spreadsheet that Aaron sent to us last week that is sortable even. Be still my beating heart. You can sort it and look at what the organization does too, to begin to get a feel for how many health applications we have, aging, mental health, and the amount. So I think we should all spend some quality time with that spreadsheet to help us get a better feel for what the requests are currently. And I'm assuming you all are going to update that worksheet periodically and send it around to us.
I like the spreadsheet. I'm fine with that idea. I guess I'm asking if we could vote on more than one at a time.
I think we can, if there is a certain type of expenditure that we want to approve, we could do a blanket approval of all of those for all the agencies, if that's what the will of the group is. You guys can make those decisions.
Fair enough. That's just what I wanted to know. Thank you.
Yep.
Well, the other thing I want to know is if we get a lot more apps from nursing homes, is when they have to put a patient into like isolation, do they bill for that? Or does Medicare or Medicaid pay them anything? Or is that all on the facility to cover all those costs?
That's why there's so much lost revenue, because no, I mean, a service is a service is a service. So they're reimbursed for a very specifically defined service, a day of care or physical therapy or whatever it is. And if they're providing fewer units of service, which is not true of nursing homes, but it is true of IDD providers and some of the other organizations that we're looking at, or categories that we're looking at, then that's just lost revenue if you have to distance clients and so on.
Every nursing home bill I've ever looked at, they bill all kinds of additional services. So if they have to isolate someone, do they bill that patient for that?
I don't think so. I just think it means they have,
Okay.
no, I don't think so. But I could be wrong. That's something Brent and his team could check out.
We can find out.
Yeah.
Well, we don't have a lot so far, but maybe we'll get a lot. That's the question I had.
Nursing homes are one of the categories that might be, so nursing home care it comes through Medicaid, which is that's something I do know about. I'm unfamiliar with Medicare, but nursing home funding comes from Medicaid. And it is tied to a specific service, and there's a reimbursement rate for that service. The nursing homes their population is stable, right? They might have to isolate or distance or disinfect more, those kinds of things. But if you look at agencies some of the other agencies, and so is the IDD population to the extent that agencies are providing residential group home care. But for the people who aren't in residential group homes, who are just out in the community, these agencies aren't seeing those people. So their population has dropped, and their Medicaid reimbursements will drop too. In some cases, as much as half of the revenue that they received at the same time last year. So it has a revenue impact. It also, from a service delivery perspective, means that those people are living, in some cases, independently or at home with parents who may or may not be able to provide supportive services.
Have we gotten more nursing home requests than what we've only seen, like 5? Have you gotten more?
I'm not aware of any, but I haven't looked at the application portal in the last couple of days. Okay, then I think that what I have heard is that we will meet next Thursday morning, same time. We will discuss our scoring. We've got some other items, follow-up for providing information. We'll get some more information from Sparks. We'll see if any of the local Sparks committee folks might be willing to join this call, or we can get some more direction from them. I've got a lot of notes, so I think we've got a number of things to work on to get ready for next week and get ready for the begin making those award recommendations after the 20th.
Hey.
Brent, would you consider sending a rough draft of the I don't know if we're calling it a score sheet or what we're calling it, but would you
Funding priority matrix. How about that?
Oh,
Ooh.
sounds good.
Hey, Stutter no more. So could you send a rough draft of that?
Sure. Oh, yeah, we'll send you that.
Then
And it,
that would make me really look at it and see what I might add or, yeah,
Good.
yeah.
and I think that is in line with what Kevin mentioned earlier. We can send that information out, get some feedback, and then we'll have a final that we will vote on at this time next week. But absolutely, we'll send that out as we're working through it.
Right. I generally agree with that. I think that'd be fine.
Okay, good.
Keep those applications coming.
Yeah.
Right.
How many do you actually have?
Aaron, do you have a number, or Shannon? You guys have been in there since I have been.
Sorry.
I'm slow to unmute myself. Let me see here.
Well, yesterday, when I was doing a quick count, we were still around 60.
Let's see, we've only gotten 28, so
Right.
you've got a lot that we haven't seen.
Well, some of those-
I'm seeing
I see
80.
81.
I see 81.
Yeah,
but
Please
The-
push those out to us so that we can start.
Duplicative and some are businesses.
Right, yeah,
some
out
of
of the
them,
81.
yes. Yeah, some of them needed to be redirected because they were businesses, and then some of them are duplicates. Like they submitted one application with 0, and then they went in and did another one. So it's not truly 81.
Correct.
That's okay. We don't need those, but the other ones,
Yeah.
send them our way.
And so
Melody, you just muted yourself.
I know that I keep doing that. I know that Jane has put together an Excel worksheet. I need one.
Okay.
I sent mine to Brent, but I
Oh.
think Aaron's is better. It's more deep. Mine is very simple. It's what they asked for and what we approved and what's left of the budget. It's very basic, what I did.
Okay, so Aaron, yes, I love it. Just update. I'd like to see everything.
Yeah.
Just to give credit where credit is due, that is Shannon's work.
Okay,
So-
Shannon.
Mhm.
Thank you.
Yeah, we'll have that out to you right away with all of the applications. And then as we're, then we'll hone in on the scoring criteria and what that looks like. And then as we're going through that process, we'll just provide it to you as we're doing it. So,
Hey, Brent, let me throw in one more thing. When we go ahead and email out this draft scoring criteria, if there are any responses or ideas or whatever that need to be proposed, go ahead and send all those to Aaron directly and do not include the rest of the members of the group. The staff can kind of hash those ideas out amongst ourselves, but we don't want to inadvertently have an open meeting by virtue of everyone sending an email that's kind of a reply all.
Kevin, is it possible to collect all that feedback and for us to see it and discuss it when we meet next Thursday?
We can provide that on an informational basis. But we just don't want to have a whole bunch of people replying to each other or,
No, but
you
we
know,
can-
whatever.
We can talk about it in real time in our meeting.
Yeah,
next
we'll
week.
talk about it in real time at the open meeting.
Right, without unfiltered. In other words, whatever has been collected by the staff will be aware of. That is,
Right.
committee members will be aware of.
Right. We can go ahead and distribute that on an informational basis and then talk about it at the next open meeting.
That sounds good. You used the words hash it out, which sounded like there would be some sort of screening going on and.
Oh, no, I don't mean it like that.
Okay.
What I mean is that if we get, 10 different emails with 20 different proposals, we can always go ahead and just kind of put that in as sort of a data dump in one big email.
I think I'm following you, but I'm not sure.
I'm not sure.
I think you understood what I was saying, so that's fine.
Sure, we're not going to weed out anything and not bring it to the whole group.
Okay.
Thank you.
Okay, anything else to come before the committee this morning? I guess hearing none, I would entertain a motion to adjourn, and we'll reconvene next week.
So moved.
Second.
Moved and seconded to adjourn. All in favor, say aye.
Aye. Aye.
Anybody want to hang around? Same sign?
Gotta go to work.
All right, we are adjourned. Thank you all.
Bye.
Bye.
You.
Thanks, everybody.
I think.